As for 3 minutes.
Well, I thank the gentlewoman for yielding, and I want to thank Representative Jenkins for her leadership and advocacy on behalf of consumers' choice in health care. And that's exactly what this bipartisan bill does, and it's all about. It's giving everyone the flexibility and the ability to make health care choices that are best for themselves and for their families. Because no matter what your views are about the president's new health care law, you have to acknowledge that the health care costs continue to go up for families, for small businesses, and for individuals alike. It's a pocketbook issue, and families want to have more tools, more flexibility to lower their costs and set aside money to help pay for health care. And today, more and more people, nearly 20 million Americans, Mr. Speaker, today, these health care savings accounts to help save for health care. These are accounts used by regular middle-income folks. In fact, the Joint Committee on Taxation just released brand new information while we were gone in the July 4th recess, pointing out that almost 80% of people who are using these HSA accounts are middle income and lower income. Half of the folks who had income between $75,000 and $200,000, and 27% of folks had incomes below $75,000. And this is because HSAs are a very important tool that gives families certainty to help lower their health care bill. It allows them to shop around for the best quality care at the lowest price, just like anything else that they want to buy. And, Mr. Speaker, HSAs are growing in popularity. We know that. It's time to improve these accounts now to make them easier for all consumers to use. In Minnesota, 800,000, again, consumers and Minnesotans are eligible and are part of these HSA health care plans. And this bill contains more common sense reforms to help patients. It does include restoring patients' ability to use their own health care dollars in a health care savings account, in a flexible spending account to purchase over-the-counter medications without having to get a doctor's prescription first. There's no reason for patients to have to make an unnecessary doctor visit just so they can use their own money to buy allergy medication or cold medication like Advil or Claritin. In addition, this bill does include provisions that I authored to make it easier for spouses to contribute and consolidate their accounts as they near retirement. And it also allows for them to pay for their health care as they open their HSA account, and allows them to set aside enough money to cover all their deductible and out-of-pocket costs. Mr. Speaker, this bill is good policy, it's bipartisan, it's fiscally responsible, and most importantly, it helps families save and pay for their health care. And I yield back.
The gentleman